Welcome to today's deep dive. We've got a fascinating case study, an 11-year-old miniature pinscher with some really mysterious brain stuff going on.
Yeah. This dog all of a sudden just started having these kind of seizure-like episodes.
Debating spells?
Yeah, almost like syncopal collapse episodes. And what was interesting is that the dog was completely normal between these episodes. And there was no history of any trauma or anything like that.
So strange.
No toxins or anything.
Yeah, that's what makes this case so interesting. So the vet started off with all the standard tests, right?
Right.
Blood work, SNAP test for tick-borne diseases, electrocardiogram, blood pressure, and get this, all those were normal.
Yeah, they really were.
Quite a mystery.
Yeah, it's like, what's going on here?
So with nothing obvious from those initial tests, the veterinary team decided to go for more advanced imaging.
Yeah, more advanced imaging.
So they actually did a CT scan, not just of the head, but also the thorax and the abdomen.
Oh, wow.
Being very thorough here, making sure they're not missing anything.
Right. So essentially thinking about an intracranial cause versus a systemic cause, right?
Right.
So something going on like a brain tumor or inflammation in the brain versus, some metabolic disorder that can sometimes cause neurological signs.
So they get the CT scan results back, and this case is a head scratcher. Turns out there was something unusual inside this dog's brain.
Yeah, so the CT scan actually revealed a mass in the right lateral ventricle of the brain.
Now, for those of us who don't know, what are the ventricles?
So the ventricles are just fluid-filled spaces within the brain.
Gotcha.
So finding a mass in one of them is not something that we see every day.
Wow, that sounds concerning. What did this mass look like on the CT?
That's where things get even more interesting.
Okay.
It had some, very particular characteristics.
Yeah.
So it was what we call hyperattenuating compared to the normal brain tissue, meaning it appeared brighter on the scan.
Oh, okay.
And this could suggest a few things, possibly blood. What was also unusual is that it did not enhance after they injected contrast.
So that made it even harder to figure out what this mass was.
Exactly.
So,
Contrast enhancement helps us to see blood vessels within the mass and determine if it's, rapidly growing.
Okay.
And so without that, we didn't really have a great answer from that CT scan.
So what was the next step? Did they have to just guess?
Not at all.
Okay, good.
That's the beauty of MRI. They went on to do an MRI to get a more detailed look at the brain and at this mass. And the MRI findings, began to paint a clearer picture.
I'm all ears. Tell me what they found.
So the MRI showed that the mass had a mixed appearance. So some areas were bright and some areas were dark, depending on what type of MRI sequence we were using.
Okay.
This is what we call mixed hyper and hypointense on T2 weighted and FLAIR images, and ISO to hyperintense on T1 weighted images.
Okay.
Essentially what this is telling us is that it's not just one uniform kind of tissue type. There's different components to this mass.
Oh, so different parts of the mass were made up of different things.
Exactly.
Okay.
And one of the really critical findings on the MRI was that there was actually blood products within this mass.
Oh, so that's the clue.
Yes.
That points to a hematoma.
A possible hematoma, yes.
So we're talking about a collection of blood,
right.
A bleed inside the brain.
Yeah.
That changes things quite a bit, doesn't it?
It does, yes.
So I imagine a lot of possibilities were running through the veterinary team's minds at this point. Were they thinking maybe a blood vessel abnormality or a problem with blood clotting or even a tumor that could bleed?
Yeah, all of those things, yeah.
All of those things.
All had to be on the table.
So what did they do next to try to narrow it down?
So the dog was started on medication for seizures, specifically levetiracetam.
Okay.
Along with some other supportive care.
That makes sense. And how did our little patient respond?
He responded really well, actually.
Oh.
Within a month of starting the levetiracetam, the seizure-like episodes completely resolved.
Oh, wow. There was a very brief episode of what looked like maybe a vestibular problem, but that quickly resolved as well.
Okay.
But yeah, the medication seemed to be doing its job.
That's great. But what about that hematoma, though? Did it just magically disappear?
Well, not quite. We're still dealing with a bleed inside the brain, and those don't resolve overnight.
Right.
So 2 months after the initial diagnosis, they did a follow-up MRI.
Okay.
And that's where we saw some really remarkable changes in the brain.
All right, I'm on the edge of my seat. Tell me, what did they find?
So the follow-up MRI showed that the mass had shrunk considerably, which is a good sign.
Okay.
But it also showed that the choroid plexus, which is the structure in the brain that produces cerebrospinal fluid, was enlarged and irregular.
Okay.
And there were still some remnants of blood visible in the subarachnoid space, which is the space between the brain and the skull.
So the hematoma was resolving, but there were still some effects, like lingering.
Right, and this is really where things start to come together.
Based on all these findings, the vets were able to come to a diagnosis of a resolving intraventricular hematoma, likely caused by an abnormality in the choroid plexus.
So all their detective work led them to the culprit. But why was it so important to pinpoint that it was a hematoma and not, like, a tumor?
That's the burning question.
Yeah.
You know, a hematoma carries a very different prognosis and treatment plan than a tumor, like a cancerous tumor.
Right, meaning a much brighter outlook for our little miniature pinscher friend.
Exactly.
Wow. This case just highlights, like, how important advanced imaging is in veterinary medicine.
It really does.
But there's more to this story. We'll be back in just a moment to dig deeper into the details of this case, including, like, what are the potential causes of these intraventricular hematomas in dogs and what they mean for treatment and long-term care. Stay with us. This case is truly remarkable, isn't it? It just, really showcases the complexity of veterinary neurology.
It really does. And you know what's particularly interesting about this case is it's actually the first reported case of a solitary resolving intraventricular hematoma in a dog documented with both CT and serial MRI findings.
So this is the first time ever that we've seen this specific type of hematoma in this location.
That's right.
And been able to document it with this detailed imaging.
Yes, and follow the case over time with repeated MRIs, which I think is really valuable.
Like having a time-lapse video of the brain.
Exactly, yeah.
So you mentioned that the hematoma was likely caused by an abnormality in the choroid plexus. Can you explain what kind of abnormality we're talking about here?
Well, that's one of the questions that we can't definitively answer in this case.
Okay.
While the imaging strongly suggests the choroid plexus abnormality without, like, a biopsy or histopathology, the specific abnormality is unknown.
So it's still a bit of a mystery then.
Right.
Are there any theories about what could cause this type of abnormality in the choroid plexus?
There are a few possibilities. One is something called a vascular malformation, which is basically just like an abnormal tangle of blood vessels.
Okay.
These can be present at birth or develop later in life.
Okay.
And they can weaken the vessel walls and make them more prone to rupture and bleeding.
So it's possible that in this case there was a malformed blood vessel in the choroid plexus that ruptured and led to the bleeding in the ventricle.
That's a possible scenario. Yep.
Okay.
Another possibility is just what we call a spontaneous rupture.
Yeah.
So, a bleed without any obvious underlying cause.
Wow.
That's obviously less common, but it can happen, especially in older dogs.
So even with all of this imaging, sometimes we're still left with a little bit of a question mark.
That's right.
But I guess the important thing is that they were able to rule out those other more serious causes.
Absolutely.
Like a tumor.
Right. And the fact that this resolved with just supportive care is a really positive outcome.
That is great. So what would you say are the kind of key takeaways from this case, especially for other veterinary professionals who might encounter something similar?
I think one of the biggest takeaways is just always consider a hematoma as a possible diagnosis when you see a mass in the brain.
Right.
Especially if the imaging shows any evidence of blood products. And
it highlights the importance of that thorough workup.
Yes.
Even when those initial tests are normal.
Absolutely.
Got to keep digging.
Yep.
So in this case, they had the initial blood work and everything was unremarkable, but it was the CT and then the MRI that were crucial in reaching that diagnosis.
Exactly.
And also, just underscores how valuable serial imaging can be.
Yes.
When you're dealing with something like this, that's dynamic, like a hematoma.
Exactly.
Being able to see those changes over time can really give you those clues.
It really does.
It's like piecing together a puzzle.
Absolutely. Yeah.
And in this case, the pieces came together and they told a really nice story of healing and recovery.
They did, yeah.
So let's shift gears a little bit and talk about what this case means for other dogs out there who might develop intraventricular hematomas.
Sure.
What should pet owners be aware of?
I think the first thing to know is that intraventricular hematomas are relatively rare in dogs.
Okay.
But when they do occur, the symptoms can vary quite a bit depending on the size of the bleed, the location of the bleed.
We're talking about those, the seizure-like episodes, the collapses, potentially problems with balance and coordination.
Exactly.
And then sometimes they can be a bit more subtle, right? Like changes in behavior, appetite.
That's right. Yep.
So the key is just to recognize anything that seems off.
Yeah.
And get to the vet as quickly as possible.
As more as possible. Yeah.
Early detection, just like in human medicine, is so important.
Yes.
And I think it's also important for pet owners to understand that a diagnosis of an intraventricular hematoma doesn't automatically mean a bad prognosis.
No, it doesn't.
It sounds scary, but, a lot of times these are manageable, right?
That's right. Yeah. Many dogs, like the one in the case study, respond well to just medication and supportive care.
Okay.
The prognosis, of course, depends on a few different things.
Sure.
Like the underlying cause of the bleed.
Okay.
And the dog's overall health.
Yeah.
But with proper treatment and monitoring, many dogs can go on to lead happy and healthy lives.
That's great to hear. What would you say are the most important things that pet owners should remember when it comes to their dog's brain health?
I think, the most important thing is just to be observant.
Okay.
Pay attention to any changes in your dog's behavior or neurological function.
Yeah. And if anything seems off, don't hesitate to contact your vet. Right.
Absolutely. Yeah. It's always better to err on the side of caution when it comes to neurological issues.
This case has really been eye-opening for me, just to learn about the complexities of the canine brain.
Yeah.
It's just incredible how much we've learned about veterinary neurology in recent years and how those advances are really helping these dogs live longer, healthier lives.
It's true. And there's still so much more to discover, I think, which is exciting.
It really is. It's a journey of constant learning and discovery.
Absolutely.
So I think we've covered a lot of ground today.
Yeah, I think so.
We've explored this case of the miniature pinscher with this mysterious brain condition.
Right.
We've delved into the world of advanced imaging.
Yep.
And we've learned about those potential causes and treatment options for intraventricular hematomas in dogs.
Right.
Is there anything else that you would like to add before we wrap things up?
I think we've covered all of the key points.
Okay.
But it's just worth emphasizing, again, that I think this case really demonstrates the power of collaborative veterinary medicine.
Yeah.
From that initial exam to the advanced imaging to the treatment, there were so many different specialists involved in this case who all worked together to get the best outcome for this dog.
Such a good point. It really does underscore the importance of the team approach.
Absolutely, yeah. Yeah, so by combining our expertise and working together, we can provide, the highest level of care for our patients.
This deep dive has been incredibly insightful. I think we've gone from a puzzling presentation to a clear diagnosis, and really all thanks to the power of advanced imaging and the dedication of this veterinary team.
Yeah, they did a great job.
And it just goes to show, that even in the face of uncertainty, there's always hope, especially with the right team in your corner.
Absolutely. And, knowledge is power.
Yeah.
So the more we understand about these conditions, the better we can care for our furry friends.
It's amazing to me how veterinary medicine is always pushing the boundaries, right?
It is.
We're seeing all these incredible advancements in diagnostics and treatments and even, surgical techniques for neurological conditions that were once considered completely inoperable.
Yeah, it's really remarkable how far we've come.
And with, the increasing availability of these advanced imaging techniques like MRI and CT, we can really diagnose and treat these conditions so much more effectively.
Absolutely.
So we've come a long way from just relying on clinical signs and basic lab work.
Right.
Now we can actually see inside the brain, pinpoint the problem and tailor those treatment plans accordingly.
And it doesn't stop there, We're seeing all these new developments in neuropharmacology as well.
Yeah.
With new medications and therapies coming out all the time.
It's really inspiring to see how far we've come. And I can only imagine the potential for even greater advancements down the road.
So too, yeah.
This case is a perfect example of that, right?
It is.
Not only the diagnostic capabilities, but also just understanding those nuances of different neurological conditions.
Yeah, I agree.
Without that knowledge, it would be so easy to misinterpret those imaging findings or jump to the wrong conclusion.
Absolutely.
And I think this is really where, the collaborative nature of veterinary medicine really shines. By working together, sharing knowledge, constantly learning, we can really, improve the lives of these animals.
Absolutely.
It's a good reminder that every case, every patient can really teach us something new.
They can.
And then, those learnings can be applied to help other animals who might be facing similar challenges.
That's right.
This case, though, rare, really, adds this valuable information to the body of veterinary knowledge.
It does.
And gives hope for other dogs and their families.
Yeah, for sure.
This deep dive has been an incredible journey for us.
It has.
Into the world of these canine intraventricular hematomas.
Yeah.
I mean, we explored this complex case. We learned about the power of advanced imaging. We talked about the importance of early detection and that collaborative approach to vet care.
Yeah.
And hopefully we've shed some light on this complex topic.
Yeah, I hope so.
And given our listeners a greater appreciation for the amazing resilience of the brain. It is amazing, even in the face of adversity.
Absolutely.
So for all our listeners out there, from Vet Neuro Jar, keep those minds inspired, hearts light, and tails wagging.